Welcome to the Concierge Care Health System podcast. The information shared in this podcast is for general informational purposes only and does not constitute medical advice. Listeners should be aware the content is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a physician or other qualified healthcare provider for medical questions.
Welcome to The Deep Dive. We're the show that takes a whole stack of sources and really pulls out the key nuggets of knowledge for you. Now, we hear a lot about ADHD in kids, right? The challenges they face. But what happens when those challenges stick around or maybe even show up for the first time in adulthood? That's what we're digging into today. We're going to try and cut through some of the noise, the common assumptions, and really look at the latest research on adult attention deficit hyperactivity disorder. So our deep dive today is into this, well, pretty complex and often misunderstood world. It's a neurodevelopmental condition. And yeah, it often persists from childhood, but maybe kind of surprisingly, it sometimes gets diagnosed for the very first time when someone's an adult. Our mission here is to sift through the research, pull out the most important stuff from the sources you shared with us, and really help you understand what adult ADHD looks like, how it's treated, what affects the outcomes, and some of the big challenges that are still out there. We want you to walk away feeling truly well-informed. Okay, let's unpack this.
It's actually quite striking when you look at just how widespread adult ADHD really is. Globally, the estimates for persistent adult ADHD, that means, symptoms that have been there since childhood, it's around 2.58%.
Okay.
But then if you look at symptomatic adult ADHD, which is just based on current symptoms, regardless of when they started, well, that number jumps quite a bit to 6.76%. And to put that into perspective, in 2020, that meant something like 139.84 million adults worldwide for the persistent type.
Wow.
And 366.33 million for the symptomatic type. It's a huge number of people impacted.
That really does shift how you think about who ADHD affects. It's massive. And bringing it closer to home, for you listening, in the U.S. alone, the estimate was about 6.0% of adults in 2023. That's like 15.5 million people.
Right.
And what I found really striking was that about half of them, they actually got diagnosed as adults after 18. So it just completely busts that myth that it's only a childhood thing. Those numbers really make you see it differently. But, okay, given those numbers, why do so many adults seem to struggle for, years without getting a diagnosis? Even though there are clinical criteria, what are the hurdles there?
That's a really crucial question. So diagnosing it in adults, it relies on established criteria, mostly from the DSM-5, the diagnostic manual, and also the ICD-11. Basically, you need this persistent pattern of inattention or hyperactivity impulsivity, or sometimes both.
Right.
And it has to significantly interfere with their functioning. A key part is that the symptoms needed to be present, at least some of them, before age 12.
Before 12, okay.
Yeah, and they need to show up in 2 or more areas of life, like at home and at work, or maybe with friends. And importantly, the symptoms can't be better explained by some other mental disorder.
So it's definitely not as simple as just, ticking off a checklist.
Yeah.
Especially when you're looking back years later, trying to remember childhood stuff. And I imagine the symptoms themselves probably look pretty different in a 40-year-old compared to a 10-year-old.
Exactly. That's a key point. While the core symptoms, inattention, hyperactivity, impulsivity, there's still the foundation. How they manifest really changes with age. So that classic hyperactivity. In adults, it often turns into this feeling of internal restlessness.
Like you can't sit still inside.
Yeah, like you're fidgety, can't really relax. Maybe your mind is just constantly churning. It's not usually the running and climbing you see in kids. And impulsivity, well, that can stick around too, but it might look more like impulsive spending or suddenly quitting jobs or maybe interrupting people a lot.
Okay.
And inattention, that often remains a really big challenge. Trouble focusing, staying organized, managing time effectively.
Yeah. And these aren't just minor personality quirks, are they?
Yeah.
If you imagine the cumulative effect of always feeling disorganized or always being late, always feeling like tasks are just overwhelming, our sources actually list some really common adult symptoms, things you might not immediately connect to ADHD, like just profound disorganization, trouble prioritizing. Chronic lateness is a big one, right? Or underestimating how long things will take.
Definitely.
Trouble multitasking, which, let's face it, is almost expected these days. Low frustration tolerance, maybe frequent mood swings, difficulty actually following through and finishing things.
Yeah.
And just finding it really hard to cope with stress.
That's such a critical list. And it makes you pause, doesn't it? How many people are out there right now maybe feeling like they're just lazy or disorganized or just not trying hard enough.
Yeah.
When really, there could be an underlying neurodevelopmental reason for those struggles. A lot of adults with ADHD, they don't realize it's a condition. They internalize it, They think it's a personal failing. And that, understandably, leads to a lot of emotional distress, and it impacts pretty much every part of their lives.
So, okay, beyond that personal struggle, that feeling of failure, what does that far-reaching impact actually look like day to day? How does it mess with things we often take for granted, like, I don't know, managing a household or sticking to a budget?
Oh, it creates huge hurdles. Untreated ADHD really impacts daily life stuff. Managing finances can be a nightmare. Keeping a home organized feels impossible sometimes. Sticking to routines, really difficult. That constant struggle with executive functions planning, prioritizing, getting started it can lead to just this pervasive feeling of being overwhelmed. And that spills directly into work and school. You see underachievement, maybe poor performance reviews, frequent job changes, sometimes even unemployment. It's actually kind of interesting. Some studies suggest adults with ADHD might have less wage loss if they're in physical jobs compared to desk jobs.
Huh. What do you think that is?
Well, maybe the structure or the physical outlet helps. Sedentary jobs often require more sustained focus and organization, which can be tougher.
Makes sense.
And then there are relationships. They definitely take a hit.
How so?
Well, inattention during conversations. It can make a partner feel ignored or like you don't care. Forgetfulness, missing anniversaries, forgetting to do things that can be mistaken for lack of caring too.
Oof, yeah.
Impulsivity can lead to saying hurtful things without thinking or making rash decisions that affect the relationship, and emotional dysregulation, those mood swings we mentioned. That can create a really unstable dynamic. Partners often end up feeling overburdened, maybe unappreciated.
And the toll doesn't stop there, right?
What about mental and physical health? It's substantial. ADHD very frequently co-occurs with other mental health conditions. Depression, anxiety, bipolar disorder, they're really common.
And probably made worse by the ADHD struggles.
Often, yes. The constant frustration and setbacks can definitely exacerbate things. There's also a significantly increased risk of substance use disorders, which we should probably talk more about.
Okay.
And on the physical side, adults with ADHD might have poorer overall physical health. Sometimes they engage in more risk-taking behaviors, which can lead to more accidents. And all of this, the struggles, the comorbidities, it can lead to really poor self-image, low self-esteem, and tragically even higher rates of suicide attempts. It really does touch everything.
Wow. Okay, so given all of that, these really far-reaching effects, the obvious question is, what helps? What can be done? It sounds like medication is often a first step, a real cornerstone for many.
That's right. Pharmacological treatments, particularly stimulants, are generally considered the first-line intervention for many adults. Stimulants like methylphenidate, you probably know it as Ritalin, or Concerta, and amphetamines like Adderall or Vyvanse.
How do they work, basically?
They primarily work by increasing the levels of certain neurotransmitters in the brain, mainly dopamine and norepinephrine. These chemicals are really important for attention, focus, and impulse control. And generally, they are quite effective in reducing those core ADHD symptoms for many people.
But they have downsides too, right?
Yeah.
Side effects.
They do. Common ones include things like decreased appetite, trouble sleeping, maybe some irritability. And there are also concerns, about potential cardiovascular effects, though often manageable. And there's the risk of misuse or diversion, which is a concern, especially given that, like you mentioned, about a third of adults with ADHD reported taking stimulants in 2023.
Okay, so if stimulants aren't the right fit, or maybe the side effects are too much, what are the alternatives? You mentioned non-stimulants earlier.
Yep. There are non-stimulant options. Atomoxetine, brand name Stradera, is one. It works differently, more on norepinephrine. Its effects usually take a bit longer to build up compared to stimulants.
Okay.
Then you have others like guanfacine and clonidine. These were originally blood pressure meds, but they can help with hyperactivity, impulsivity, and sometimes tics if those are present.
Right.
And another one sometimes used, though it's technically off-label for ADHD, is bupropion. That's an antidepressant, Wellbutrin, but it also has some effects on dopamine and norepinephrine, so it can be helpful, especially if someone also has depression.
So you got options. How do they stack up against each other generally? Are stimulants usually seen as more effective?
If we're looking purely at core symptom reduction, yeah, systematic reviews generally show that stimulants tend to be more effective, have larger effect sizes. Now, there's been some debate in the past about whether medication alone directly improves overall quality of life, but more recent, large meta-analyses are showing that yes, amphetamines, methylphenidate, and even atomoxetine do significantly improve quality of life for adults with ADHD. The effect sizes are moderate, but definitely significant.
And what about long-term? Does taking medication have benefits beyond just symptom control day to day?
That's a great question, and the research suggests yes. Long-term studies point towards pharmacotherapy being associated with better outcomes in several areas like improved academic performance, better social functioning, improved employment situations, and importantly, it seems to be linked with a reduced risk of developing substance abuse problems later on and potentially less involvement in criminal behavior. So the benefits can be quite broad.
That's really significant, but it also sounds like medication, while powerful, might not be the whole picture for everyone. It doesn't magically fix everything, right?
Exactly. It addresses the core neurobiological symptoms, but it doesn't necessarily teach coping skills or fix long-standing patterns of behavior or negative self-talk that might have developed over years.
So that's where the psychosocial interventions come in. Therapy, coaching, things like that.
Precisely. And one of the most well-researched and effective is cognitive behavioral therapy, or CBT, adapted specifically for adult ADHD.
How does CBT help specifically with ADHD?
It really focuses on practical skills and changing unhelpful thought patterns. So it helps people develop better organizational skills, improve time management, figure out ways to manage distractibility. It also works on things like problem-solving skills, emotional regulation learning to handle frustration or mood swings better, and challenging those negative beliefs about oneself that often come with ADHD.
And is it effective?
Yeah, meta-analyses show CBT is definitely effective. It helps reduce self-reported ADHD symptoms, seems to improve executive functioning, and it's also really good for tackling those common co-occurring conditions like depression and anxiety.
Okay, CBT makes sense. What other kinds of psychosocial support are out there? I think you mentioned DBT.
Right, dialectical behavior therapy, or DBT. It shares some roots with CBT, but puts a really strong emphasis on emotional regulation, distress tolerance, and interpersonal effectiveness. It's often adapted for adults with ADHD, particularly those who struggle a lot with impulsivity and intense emotions.
And ADHD coaching. How is that different from therapy?
ADHD coaching is more collaborative and goal-oriented. It's less about treating psychopathology and more about partnering with the client to identify their strengths, set practical goals like improving organization or time management, and developing strategies to achieve them. It's often structured, maybe around 12 weekly sessions, very action-focused.
Gotcha. And support groups.
Hugely valuable for many people, just connecting with others who get it, who share similar experiences. It can be incredibly validating. It reduces that feeling of isolation, provides emotional support, and people share practical tips and strategies too.
So putting it all together, if someone's looking for the most effective way forward, what's the general recommendation? Is it usually picking one or combining things?
For most adults with ADHD, the consensus really points towards a combination approach. Using medication and psychosocial interventions together often yields the best outcomes.
Why is the combo usually better?
Because it tackles the problem from both angles. Medication helps manage the core neurobiological symptoms, the inattention, the impulsivity. And then therapy or coaching provides the skills and strategies to manage the functional impairments, the coping deficits, the emotional fallout. It's synergistic.
Okay.
In fact, a big meta-analysis just published in 2024 found exactly that. CBT combined with medication was significantly more effective than medication alone for improving adult ADHD symptoms.
Interesting. Did it say anything about how long those benefits last?
Yeah, it found the benefits lasted for at least 3 months after the CBT ended, which suggests, maybe booster sessions or more intensified CBT might be needed to really sustain those improvements long term.
Right. It's not necessarily a one-and-done fix.
Definitely not. It's usually an ongoing process of management and skill building.
Okay. Beyond the standard medical and therapeutic treatments, what about lifestyle stuff or complementary approaches? Do those play a role?
They absolutely can play a supportive role. Think of them as important adjuncts. Regular exercise, for instance, has pretty solid research behind it for improving attention, executive function, and mood in people with ADHD.
Really? How much improvement?
Some studies have shown around a 30% improvement in inattention symptoms just from incorporating regular exercise.
Wow, that's significant.
It really is. And sleep optimization is huge too. Poor sleep makes ADHD symptoms worse, and unfortunately, something like 60% of adults with ADHD report having sleep problems.
So what helps with sleep?
Things like consistent sleep hygiene, regular bedtimes and wake times. Morning light exposure can help regulate the body clock. Some find melatonin helpful, or even weighted blankets for that calming pressure.
Okay. And nutrition. Does what you eat matter?
The evidence there is maybe less definitive than for exercise or sleep, but a balanced diet is always beneficial for brain health. There's some promising research, particularly around omega-3 fatty acids, and ensuring adequate levels of certain minerals like zinc, iron, and magnesium might be important, especially if someone has a deficiency, as those can sometimes be linked to attention issues.
Gotcha. Anything else on the lifestyle front?
Yeah, mindfulness practices like meditation or mindful breathing, they can be really helpful for improving attention, focus, and especially emotional regulation, learning to observe thoughts and feelings without immediately reacting.
That makes sense.
And then there are just practical workflow modifications. This can make a huge difference day to day.
Like what?
Creating a workspace that minimizes distractions, using organizational tools, planners, apps, reminders, breaking big tasks down into smaller, more manageable steps.
The Pomodoro technique, maybe?
Exactly. Using timers like the Pomodoro technique, establishing consistent routines where possible, and something called body doubling.
Body doubling. What's that?
It's basically working either physically or virtually in the presence of another person. Just having someone else there, even if they're doing their own thing, can somehow help people with ADHD stay focused and on task.
Huh. Interesting.
Yeah, it's quite popular in the ADHD community. But again, it's really important to stress that these lifestyle and complementary approaches are generally seen as adjunctive. They support the main treatments. They don't typically replace the need for medication or therapy if those are indicated.
Right. They're tools in the toolbox, but maybe not the whole solution on their own.
Precisely.
Okay, so we've talked about treatments, but you also mentioned that treatment effectiveness isn't always straightforward. It can be influenced by other factors. What's one of the biggest complicating factors you see?
Co-occurring conditions, without a doubt. It's actually more the rule than the exception. ADHD rarely travels alone.
What kind of conditions are most common?
Mood disorders like depression and dysthymia, and anxiety disorders, generalized anxiety, social anxiety are incredibly common alongside adult ADHD. And often the daily struggles and frustrations of living with untreated ADHD can really exacerbate these conditions.
So it becomes this kind of vicious cycle.
Exactly, which raises that really important question. Okay, if someone has both ADHD and, say, depression, how do you treat that effectively?
Yeah, what comes first?
Well, the approach can vary. Sometimes treating the ADHD effectively with medication can actually alleviate some of the secondary mood or anxiety symptoms because the person is functioning better and feeling less frustrated.
Okay.
Other times, you need to target both conditions simultaneously. That might mean using ADHD medication alongside an antidepressant like an SSRI or SNRI, and definitely incorporating therapy like CBT, which can address symptoms of both.
You also mentioned substance use disorders, SUDs, being a concern. How much higher is the risk?
Significantly higher. One statistic mentioned in the sources puts the rate at around 15.2% for adults with ADHD having an SUD, compared to just 5.6% in adults without ADHD.
Wow, that is a huge difference. And that brings up the question about using stimulant medication, right? If someone has a history of substance abuse, isn't there a concern about prescribing stimulants?
That's a common and understandable concern. However, the evidence we have currently suggests that prescribing stimulants to adults with ADHD doesn't necessarily increase their risk of developing a new substance use disorder.
Okay.
And maybe even more importantly, for individuals who already have co-occurring ADHD and an SUD, treating the ADHD with stimulants doesn't seem to worsen their substance use outcomes. In fact, sometimes treating the ADHD can help them better engage with SUD treatment.
So it's not an automatic no to stimulant.
Not necessarily, but it requires careful assessment and monitoring. In some cases, a non-stimulant medication like atomoxetine might be preferred. But the key takeaway is that you absolutely need an integrated treatment plan that addresses both the ADHD and the SUD simultaneously for the best chance of success. You can't ignore one and hope the other gets better.
That makes sense. Now, another factor you touched on was gender. You said core symptoms are similar, but manifestation and diagnosis can differ between men and women. What specifically might lead to women getting diagnosed later, or maybe even missed sometimes? Is it that masking thing you mentioned?
It often seems to be a mix of things. Women are diagnosed later in life more often than men. Part of that might be because they tend to present more often with the inattentive symptoms, which are less outwardly disruptive than hyperactivity.
So they don't fit the classic hyperboy stereotype.
Exactly, and societal expectations might also play a role. Girls and women may feel more pressure to compensate or mask their symptoms, developing these elaborate coping strategies to appear organized or attentive, even when they're struggling internally. This symptom masking can make it harder for clinicians and even the women themselves to recognize the underlying ADHD.
Are there subtle differences in the specific symptoms reported more often by women versus men?
Yeah, some research indicates women might report more frequently things like loses things often, or that feeling of internal restlessness, feels restless and maybe talks excessively,
Okay.
whereas men might report more impairment specifically related to work. Interestingly, some studies show women report more impairment in their social functioning compared to men, so there are these nuances.
The implication there is pretty clear. We need diagnostic approaches that are maybe more sensitive to these potential gender differences. And perhaps treatment plans for women might need a stronger focus on things like building self-esteem, emotional regulation skills, and maybe navigating social challenges.
Absolutely. A one-size-fits-all approach doesn't quite capture the full picture.
And thinking about different groups, we can't ignore cultural and ethnic factors either. Do we see disparities there?
Yes, unfortunately, there are significant disparities in both the diagnosis and treatment of ADHD across racial and ethnic groups. Generally, individuals from racial and ethnic minority groups are less likely to be diagnosed and less likely to receive treatment compared to white individuals.
Why is that? What are the barriers?
It's complex. Factors include socioeconomic status affecting access to healthcare, lack of insurance, difficulties finding knowledgeable providers, but also things like stigma within certain communities, cultural mistrust of the medical system, and maybe differing cultural interpretations of the symptoms themselves. For instance, the sources mentioned Asian Americans tend to have some of the lowest reported rates of ADHD diagnosis and treatment.
Any idea why that might be?
Well, one hypothesis mentioned is the influence of the model minority myth. This stereotype can create pressure to succeed and potentially discourage individuals or families from acknowledging or seeking help for difficulties that don't fit that image.
That's a really powerful point. Okay, let's unpack this cultural aspect a bit more. How do cultural beliefs themselves, like maybe individualism versus collectivism, actually shape how ADHD is seen and treated?
That's a fascinating area. Cultural values definitely play a role. In more individualistic cultures, like much of the West, there might be more emphasis on individual achievement and performance. ADHD might be viewed more through a medical or neurobiological lens, and pharmacological treatment might be more readily accepted.
Okay.
In more collectivistic cultures, where group harmony and interdependence are highly valued, symptoms might be interpreted differently, maybe attributed more to environmental factors or seen as something to be managed within the family or community. There might be a greater preference for non-pharmacological approaches or traditional remedies.
And stigma could play out differently, too.
For sure. In some cultures, there might be greater stigma associated with mental health conditions generally, perhaps due to concerns about family reputation or saving face. This could make individuals very reluctant to seek a formal diagnosis or treatment.
So the bottom line is, care needs to be culturally sensitive.
Absolutely critical. We need healthcare providers who understand these nuances, assessments that are culturally appropriate, and interventions that can be adapted to resonate with different cultural backgrounds and beliefs. Without that, we risk perpetuating these disparities.
Yeah, definitely. So bring it back to the individual level. We've talked about symptoms, treatment, all these factors. Ultimately, the goal isn't just making the symptoms go away, right? It's about improving someone's overall life.
Exactly. It's about quality of life. And the research is pretty clear here. Untreated ADHD is consistently linked with poorer outcomes, lower self-esteem, difficulties with social functioning, feeling less satisfied with life overall.
But treatment can change that.
Yes. Multimodal treatment, that combination approach we discussed, is shown to significantly improve these areas. Better self-esteem, better social skills and relationships, but also improvements in things like academic achievement, job stability, employment prospects. And as we mentioned, it can reduce the risk of those negative long-term outcomes like substance abuse or delinquency. So While medication targets the core symptoms effectively, it's often the psychosocial interventions, the therapy, the coaching, the skill building that really help people learn to cope, manage their emotions, and build that foundation for a better overall quality of life.
That makes a lot of sense. It's about the whole person, not just the checklist of symptoms. Okay, despite all the progress in understanding and treating adult ADHD, it sounds like there are still some pretty significant challenges. What stands out as maybe the most pressing issue right now?
I think one of the biggest, honestly, is just the sheer scale of underdiagnosis and misdiagnosis. It's alarming. Some experts estimate that like 75%, maybe even 80% of adults who actually have ADHD are currently undiagnosed, missed completely.
75 to 80%. That's staggering. Why is it being missed so often?
Well, several reasons we've touched on. Symptoms change as people get older. They don't look like the childhood stereotype.
Right.
There's a huge overlap between ADHD symptoms and symptoms of other common conditions like anxiety, depression, even sometimes bipolar disorder, which makes differential diagnosis tricky.
So it gets mistaken for something else.
Frequently. And then there's the challenge of recalling childhood symptoms accurately. That's a key part of the diagnostic criteria. But remembering specific examples of inattention or hyperactivity from when you were, say, 8 or 10 years old, that can be really difficult for adults.
Yeah, I can imagine. And the consequences of not getting diagnosed when you actually have it must be pretty profound, right?
Absolutely. It means people continue to struggle, often blaming themselves. It increases the risk for developing those secondary mental health problems we talked about, like depression and anxiety. It leads to poorer outcomes at work, more instability in relationships. Yeah, it means a lot of people are struggling unnecessarily in silence.
So, okay, diagnosis is one hurdle. But even for those who do get a diagnosis, getting access to care and then sticking with treatment sounds like another major challenge.
It really is. Access is a huge issue. People face logistical barriers, finding the time for appointments, the cost of treatment, transportation. There are perceptual barriers like stigma or maybe mistrust of the healthcare system, feeling like they won't be taken seriously. And often there just aren't enough healthcare providers who are knowledgeable and experienced in diagnosing and treating adult ADHD. These access issues tend to hit racial and ethnic minority groups disproportionately hard, too.
And even if you overcome those barriers and start treatment, sticking with it can be tough.
Yeah. Adherence is a real challenge, and ironically, the ADHD symptoms themselves can interfere with treatment adherence.
How so?
Well, difficulty with organization and memory makes it hard to remember to take medication consistently or to keep track of appointments. Impulsivity might lead someone to stop treatment abruptly. Side effects from medication can also be a factor. And then there are external factors, like the medication shortages we've seen recently. In 2023, the sources mentioned that over 2/3 of adults taking prescription stimulants reported having difficulty actually filling their prescriptions because the pharmacies just didn't have them. That's a massive real-world barrier.
Wow, over 2/3. That's huge. What's fascinating here, though, is how telehealth seems to have stepped in to fill some of that access gap. Almost half of adults with ADHD said they'd use telehealth for their condition.
Yeah, telehealth has definitely been a positive development for improving access for many people. It can overcome some of those geographical and logistical barriers, which is great.
But it doesn't solve everything.
No, definitely not. And it doesn't really address the underlying issue of stigma, which is still a huge barrier. This persistent misconception that ADHD is just laziness or a lack of willpower or an excuse. It really impacts people's willingness to even seek help in the first place. And even if they do, it can affect whether they stick with treatment or how open they are about it.
Yeah, that stigma is powerful. Okay, so looking ahead then, are there hopeful signs? What's emerging on the treatment or research front?
There are definitely some exciting developments. One area is digital therapeutics.
Like apps and stuff?
Exactly. Mobile apps, even specially designed video games that are being developed to provide engaging, personalized support. They might offer tools for organization, time management, focus training, or even CBT-based exercises. The idea is to make support more accessible and maybe more engaging for some people.
Interesting. What else?
There's also ongoing research into neuromodulation techniques. Things like neurofeedback, where people learn to regulate their own brainwave activity, or transcranial direct current stimulation, TDCS, which uses mild electrical currents to stimulate certain brain areas.
Is that stuff ready for prime time yet?
The research for adult ADHD is still relatively early, I'd say. It's promising, but we need more large-scale studies to really understand how effective these are and for whom.
Okay. And broader research. Where are scientists looking?
Big frontiers include searching for reliable biomarkers, biological markers that could help make diagnosis more objective, maybe using brain imaging or genetic testing down the line.
That would be a game changer.
It really would. There's also a big push towards personalized medicine, trying to figure out which treatments work best for which specific individuals based on their unique symptom profile, genetics, or other factors.
Right, moving beyond one size fits all.
Exactly. And just conducting more robust, long-term studies to really understand the sustained benefits of different treatments over many years, not just a few months.
Okay, one last crucial area seems to be the workplace. Given how much ADHD can impact work time management, organization, what about accommodations and support there?
Yeah, occupational functioning is a major area of difficulty for many adults with ADHD. It contributes to job instability, underemployment, but getting a diagnosis can actually be a huge relief in this context.
How so?
It helps reframe past struggles. Instead of I'm lazy or I'm incompetent, it becomes, okay, my brain works differently, and that's why I struggled with X, Y, and Z. That shifting perspective can be incredibly powerful for self-esteem and figuring out what support is needed moving forward.
So what kind of workplace accommodations can actually be effective? Can you give some concrete examples?
Sure. Simple things can make a big difference. Providing a quieter workspace or noise-canceling headphones to minimize distractions. Allowing for flexible scheduling, maybe starting earlier or later or having more flexible break times.
Okay.
Helping break down large projects into smaller, more manageable tasks with clear deadlines. Utilizing technology, digital reminders, calendar alerts, project management software.
Right.
Even something as simple as allowing for movement during long meetings, if it's not disruptive, like standing at the back or using a fidget tool quietly. The key is really open communication between the employee and the employer about what specific strategies might help.
And are there formal resources available too? I think the sources mentioned vocational rehabilitation.
Yes, vocational rehabilitation or VR services. These are typically government-sponsored programs available in many places. They're designed to help individuals with disabilities, including ADHD, prepare for, find, and keep employment. They can offer things like career counseling, skills training, job placement assistance, and even support negotiating accommodations with employers. It can be a really valuable resource for adults with ADHD navigating the work world.
Wow. Okay, what a deep dive this has been. We've really covered a lot of ground. We've looked at the surprising scope of adult ADHD globally, how the symptoms can look different in adults, and just how deeply it can impact everything: daily life, work, relationships, mental and physical health.
Yeah, and we explored the treatment landscape, the importance of that multimodal approach, combining medication, therapy like CBT, coaching, and those crucial lifestyle supports like exercise and sleep.
Right, and we highlighted how important it is to consider those influencing factors like co-occurring conditions, potential gender differences in presentation, and the critical need for culturally sensitive care to address disparities.
And we didn't shy away from the challenges either: the huge issue of underdiagnosis, the barriers to accessing care, the medication shortages, that persistent stigma.
Yeah.
But also looking forward to those promising developments in digital therapeutics and research, and the importance of practical support like workplace accommodations and VR services.
So, after all that, what does this really mean for you listening? Well, maybe you've recognized some of these patterns, these struggles, in yourself or perhaps in someone you know. And maybe you're realizing, maybe it's not just about trying harder. Maybe there's something else going on. Perhaps this deep dive has already started to shift some of your assumptions about what ADHD really is and who it affects. It's definitely not just the stereotype. So we want to challenge you maybe to think about this. How could a deeper, more nuanced understanding of neurodiversity in adult ADHD, specifically, how could that actually transform things? Not just for individuals, but for our systems.
Yeah, like our schools, our workplaces, our healthcare systems.
Exactly. Think about what it might look like to foster environments that are genuinely more inclusive and supportive for everyone, whatever their neurotype. Maybe just try observing the world around you this week through this slightly different lens. Notice the subtle ways ADHD might manifest in adults you interact with. Or maybe spot opportunities, even small ones, for offering better support or understanding in your own life, in your community, or even at work. It's something to think about.
Concierge Care, providing world-class, personalized care for patients and members. Taking a proactive approach by offering its free digital health clinic for anyone in need of these services. Reach out to us via our website, www.health.conciergecare.net, or give us a phone call at 786 809-2345.